All right, so today we're going to talk about Medicare Part D plans. Medicare Part D is Medicare's prescription drug plan. And today I'm hopefully going to help explain how Medicare Part D works. It is a very complicated product, but I hope I can help make it clear to you. First, with Medicare Part D, there are 4 stages of coverage. The best way to explain the Medicare Part D stages of coverage is that in every stage of coverage, you will pay a different amount for your prescriptions. And we'll get into that in a moment, but first I want to try to just explain it first. So the first stage of coverage is called your deductible level. And so when you have a deductible, you pay the full price of your prescriptions. And the deductible for 2021 is $445, and Medicare sets that deductible. And so the other thing with prescription drug plans is Medicare sets like a standard plan, and private insurance companies that sell the Medicare prescription plans come in and they can sell the standard plan or they can increase coverage, but they cannot decrease coverage. So coverage can always be enhanced, but not necessarily decreased. So the deductible that Medicare set for 2021 is $445. And so if someone is in their first level of coverage called the deductible level, then they're going to pay full price of their medications until they've reached that deductible. Now, there are some plans that exist under Medicare Part D that waive that deductible for generic prescriptions. And so those plans tend to be a lot more popular for people who are on generic prescriptions. So assume you've on a brand name drug and you've met your deductible, the $445. The second level of coverage is called your initial coverage level. And so when you're in your initial coverage level, it is more typical and more traditional, like your employer insurance or your marketplace ACA coverage. During your initial coverage level, you're going to pay a copay. A copay is a set dollar amount that you pay for each prescription. Now, under Medicare Part D, there are 5 tiers of prescriptions. You have Tier 1, which is a preferred generic, Tier 2, which is a generic, Tier 3, which is a preferred brand name, and then Tier 4, which is a non-preferred brand name, and then Tier 5 are specialty prescriptions. And each tier, every company will set a different copay. Again, Medicare has set a standard of what the copay can be, and the companies cannot charge more than that particular copay or percentage. So you will stay in your initial coverage level and continue to pay copayments until the cost of your medications have reached $4,130. And that's the cost of your medications. So not what you're paying, but the full cost of your medications. So if you have an $800 prescription each month when you fill it, but you only pay a $47 copay, that $800 a month is what's going towards that maximum level of coverage, which is $4,130. So if you reached the $4,130 anytime through a given year, then you fall into what is called your Stage 3 of coverage. During your Stage 3 of coverage, it's also called the donut hole or the coverage gap, but donut hole is what it's most commonly referred to. You fall into a hole of coverage where you have to start paying 25% of the cost of all of your medications. I've been doing this for about 15 years, and it used to be that when someone fell into the donut hole or the coverage gap, they had absolutely no coverage. So we really have come a long way from no coverage to now you're only paying 25% of the cost of your medications. Now, 25% of the cost of medications can be a lot for prescriptions that are really expensive. And so it's possible that your generics will go down during the coverage level, but your brand names will more than likely increase in price during your coverage gap. Now, you stay in the coverage gap until your true out-of-pocket cost reach $6,550. If your medications ever reach $6,550, then you fall into the last stage of coverage in a given year called catastrophic coverage. When you're here, you're not going to pay more than 5% of the cost of your medications. And so as you can see the trend, each stage of coverage, you're going to pay a different amount for your prescriptions. I know it's complicated, but hopefully, I can have made it a little bit clear for you of how that will work. Now, let's say a lot of people don't meet their coverage gap or their catastrophic coverage. So what I typically recommend to people is that here's your plan, this is your copays, you'll not hit your coverage gap, But if your situation changes throughout the year, give me a call and let me walk you through the plan that you have so that I can help explain how the cost of your medications are going to change at any time throughout the year. Thanks for joining in today and learning more about Medicare. If you'd like, click more of my videos and we can learn about Medicare together.